Hello, nursing students. This is Stephen-Castro. I'm going to do a little presentation on acid-base balance. I've provided some links to the PowerPoint as well as a handout in PDF form. If you want to print those off and follow along, it might be helpful. Here's a list of the learning objectives which can be found in your lesson plans. I also left a link for you in the upper right corner. So what is acid base? Well, it's basically the measurement of the pH of our blood, and that is all going to be dependent on how many hydrogen ions we have at any given time. The normal range is 7.35 to 7.45. Homeostasis, that's basically balance. So we are constantly trying to find a state of homeostasis or balance in our body, and including the pH. So acids will release hydrogen ions, and bases or alkalis will accept hydrogen ions in hopes to regulate the pH. If our bodies are unable to maintain acid-base balance, it really can start to negatively affect our organs. Anything below 7.0 or greater than 7.6 for any length of time is incompatible with life. So our bodies, in efforts to maintain this pH by controlling the hydrogen ions, has three systems. You have a buffer system, we have our respiratory system, and our renal system. Buffers are little substances in our bodies that will either bind with hydrogen or they will release hydrogen ions in hopes to control the pH of our body. The respiratory system controls pH by regulating carbonic acid. And carbonic acid is just carbon dioxide with water. And when we breathe out carbon dioxide. So in effect, by slowing down or speeding up breathing, you're going to change the acidity. In alkalosis, for example, when the body is too basic or less acidic, the body will decrease the rate and depth of respiration, causing us to hang on to more of that CO2. When combined with water, that's going to be carbonic acid, so it'll make us more acidic. The kidneys are really responsible for that long-term maintenance of our pH system. The kidneys can regulate both hydrogen and bicarb, in essence, to control and maintain our pH. But it's a slower process than the respiratory system. So the PaCO2, or CO2, is basically how much carbon dioxide is in the blood. So when you think CO2, think respiratory. PaO2 is the amount of oxygen in the blood. And the HCO3 is the amount of bicarb in the blood. Bicarb, kidneys. The base excess really kind of gives us a picture of the degree of the imbalance. It kind of tells us how well we can buffer something. We should have a normal range of 2 to negative 2. Normal pH is 7.35 to 7.45. We have that buffer system, which is the bicarbonate carbonic acid system, to help regulate that pH. The kidneys are going to regulate bicarb, and the lungs, with the help of that system in the brain, will help control CO2. Quick quiz. What was the most common buffer system in the body? If you answered D, bicarbonate carbonic acid, you got it right. So you're in your third semester of nursing school, and you've already been through a lot of concepts, but they really all kind of overlap. One concept can affect another, and acid-base is no different. It can affect the cognition, fluid and electrolytes, perfusion, and oxygenation. We'll talk about some of these. So remember, homeostasis is 7.35 to 7.45. We get acidotic when that pH drops below 7.35. We get alkalotic when the pH goes above 7.45. So when we refer to metabolic, remember metabolic really is a reflection of the bicarb concentration. And what controls the bicarb concentration? That's the kidneys. So in metabolic acidosis, we don't have enough bicarb. In metabolic alkalosis, we have too much. Now, respiratory, on the other hand, is really a measure of the carbon dioxide or carbonic acid, because with water it turns into carbonic acid. It's a measure of that. So in respiratory acidosis, we have too much carbon dioxide or carbonic acid. In alkalosis, we have too little. In the perfect world, it'd be nice to be able to find one simple underlying cause that causes the acid-base balance. But most patients don't have just one cause. We have a lot of complex patients with all kinds of things going on. And a lot of patients have what are called mixed disorders, which are a combination of respiratory and metabolic. Compensation happens when one system tries to repair the damage that's kind of being done by the other system. For example, if the kidneys are causing the acid-base imbalance, the respiratory system is going to try to fix it. And if they are successful, that's called compensated. This is a great little table I had from a few years ago. It kind of gives the primary disorder, what the underlying cause is, how they're going to be compensated, and what's going to be the effect on the ABG. If you're a logistical learner and like charts and graphs, this is for you. ABG stands for arterial blood gas. That's the blood from the artery that gives us our values of our pH, our CO2, and our bicarb. Metabolic acidosis usually occurs more commonly in people with chronic conditions, whereas alkalosis most commonly happens in more acute issues. Risk factors for respiratory acidosis tend to correspond with hypoventilation, like COPD or pneumonia. Whereas respiratory alkalosis, a lot of times we can relate that to more acute issues like hyperventilating from anxiety or even aspirin ingestion. For you, those table and graph people, here is another great table that gives some common causes for the major acid-base imbalances. It would be a good one to review. So what are your nursing responsibilities for a patient with acid-base imbalances? Start with a very thorough history, including any medical problems or conditions, any medications they're on, include over-the-counter medications, very important, any complementary therapies that they're having, don't forget the vital signs, and the pulse ox. Lifespan considerations. Really, infants, children, and older adults are at higher risk for fluid and electrolyte imbalances. And you've been over fluid and electrolytes, so you know they're at higher risk. And when they're at higher risk for that, it also puts them at higher risk for acid-base imbalances because those concepts overlap. Remember, your ABG stands for arterial blood gas, and that is that arterial blood draw that they get from patients that will give us a reading of their pH, their CO2, and their HCO3. Typically, it's done by a respiratory therapist. Sometimes physicians can do it, and nurses who've been specially trained. Once we get those ABG results, we need to learn how to interpret them. And it's best to use a systematic approach. I personally like the tic-tac-toe method, and that's what I teach in the class. But we're going to evaluate each measurement on that ABG, the pH, the CO2, and the bicarb, and then we'll analyze it to determine what the underlying cause is. We always start off by looking at the pH. Remember, the normal range is 7.35 to 7.45. Anything below 7.35 is acidotic, higher than 7.45 is alkalotic. We determine where our client is. Then we'll look at the CO2 and the HCO3 to determine whether it's respiratory or metabolic. Our in-class activity will revolve around interpreting ABGs. If you don't quite get it now, don't worry, we'll work on it in class and it will make more sense. And remember, the goal of treatment is to really kind of fix the underlying cause. If it's a metabolic issue, we have to address it. If it's a respiratory issue, we have to address that. Here are some independent nursing actions that we can do to help our clients with acid-base imbalances or those that are at risk for acid-base imbalances. Assessing that respiratory function, checking the renal function, making sure they have a nice patent airway, monitor their SpO2, I's and O's, and daily weight. Remember I said acid-base imbalances affect the organs? Well, one of the main organs it can affect is the brain, or cognition. So we're always going to assess for the level of consciousness and their neurological function, as well as their vital signs, and we always want to report any changes in our client's condition. I know I mentioned it before, but a thorough client history is imperative to clients with acid-base imbalances. And sometimes if they're really sick, they may not be able to give you that thorough history. So if you have family members or a medical record to review, that's always helpful. For pharmacologic therapy, our goal is to return our client to homeostasis. In acidosis, we like to get rid of those extra acids, so sometimes we have to give them bicarb. And I could talk more about that in class. We don't give it near as much as we used to, but it is still given. Anytime we're trying to correct acidosis by giving bicarb, we're always at risk of overcorrecting our client. So we need to be very, very conscious of our assessment and monitor for signs of overcorrection. And that would be putting them into an alkalotic state. With any pharmacologic therapy, you're going to monitor your client's condition and their response to those medications. Frequently, they're going to have more than one ABG drawn, and you'll have to interpret those results as ongoing to see how well your therapy is working. And just continue to assess. Remember, judicious use of sodium bicarb. Sodium bicarb also has some additional uses and or side effects when you give it. It alkalines the urine, It also helps kind of get rid of the acidic substances. In chronic renal failure, remember, the kidneys just don't excrete those hydrogen ions. You have to use caution. Clients with chronic health conditions like chronic renal failure are at risk constantly for acid-base imbalances, particularly metabolic acidosis. For that reason, they may be taking sodium bicarb on a daily basis in a tablet form. Just review your pharmacology for this medication. In severe cases of respiratory acidosis, the client may need additional respiratory support, including intubation or ventilator management. You'll learn more about that in your fourth semester. They tend to also have retention of carbon dioxide as well as hypoxemia, and those all need to be corrected. I hope you found this presentation of acid-base imbalance helpful. If you have any questions, please don't hesitate to reach out to me. And on our 2 days of acid-base, on day 1, we're going to do some exercises in class on ABG interpretation. So if you struggle, we'll work on that. And on our second day, we have a little project. Happy studying.